In this video, we will focus on complex regional pain syndrome. So pain for one of many reasons in a particular region, and complex because it may not be associated with a pain stimulus. It may be an exaggerated response even when there is no stimulus. So that is complex regional pain syndrome. We will work on the details next. Has another name called reflex sympathetic dystrophy or causalgia. Okay, those are other names for this condition, abbreviated as CRPS. So, say there is an injury, say there was a surgery, or sometimes none of these, okay? Just an inappropriate activation of inflammatory cascade, okay? Just randomly, an inflammation is triggered in a particular area. Anytime there is inflammation, there is release of chemicals from the arriving white blood cells as well as local tissue that's involved. The number of chemicals, the names of the chemicals have been brought here and there, but here is another list of chemicals. You're thinking about substance P, neuropeptide Y, CGRP, just to name a few, okay? These are some neuropeptides that we're talking about. A sensitization of pain stimuli. So random inflammation and random triggering of pain is what you're thinking about here. And dysregulation of the sympathetic system. Okay, unwanted, unnecessary inflammation, release of chemicals, and now affecting the normal functioning of the sympathetic system. It is supposed to be more common in women, especially in postmenopausal women. Okay, there may be a genetic predisposition as well. Okay, so what do we expect here? Pain. Okay, burning, stinging, tearing type of pain. With inflammation, there is swelling, skin changes, okay, redness, swelling, warmth, all those inflammatory signs. Bone demineralization. This is again, if it's occurring in the bone, chemicals locally can trigger the dissolving of the bone, destruction of the bone matrix, decreased hair growth. Again, the list of chemicals that are involved could be responsible, and motor and autonomic dysfunction. Okay, temperature variability, sweat production. These terms have been discussed with other conditions related to peripheral nervous system disorders before. So it's pretty much on the same wavelength. Here, it's the unexpected inflammation, chemicals involved, triggering pain. Okay? So this is not totally accepted. There are questions about the stages of development of complex regional pain syndrome. Step by step is what is laid out, but it may not necessarily go this way, is the argument. Whatever it is, let's take a look at the 3 stages. So initially, there is that pain, okay, throbbing, burning pain in a limb. So there is no one specific distribution of a specific nerve. Okay, so it's kind of a random part. Allodynia, you know what allodynia is? This is central sensitization. Okay, pain is exaggerated centrally. Instead of modulating pain, central nervous system is doing it in the opposite manner, that is exaggerating pain. Okay, and vasomotor disturbances. Vasomotor meaning you have vasodilation and that type of function is altered. Development of soft tissue edema, all right, inflammation means edema, and muscle atrophy, skin changes could go on for 3 to 6 months. So this is the next stage. Okay, first it's pain and exaggerated pain. Next you see swelling, muscle atrophy, skin changes that started may go on for a length of time. Then the later stage is where the movement is becoming a challenge, limitation of range of motion. Okay, you can only lift so much or take so many steps. Contractures, that means limitation, and then atrophy we already saw, skin atrophy this time, fragility, it could be the bone that's fragile, and then movement can be, having normal gait is an issue, nail changes, lack of hair growth, bone demineralization. So these are all related to various chemicals and also the alteration of the sympathetic function. Okay, now here is a very nice summary of how to diagnose patients with complex regional pain syndrome. Okay, Budapest clinical criteria is the way they call it. Okay, so this is the way to diagnose CRPS. Let's take a look. Patient must have all of the following, that is continued pain that's disproportionate to the inciting event. Like inciting event is whatever starts this pain, whether it's injury, surgery, or sometimes none of these, remember? So the pain is there, that's the main thing. Okay, report at least one symptom in 3 of the categories, the 3 categories that we talked about, at least one symptom. So you can think about skin changes, okay, muscle atrophy, edema, okay, then what else would we say? Changes in your nail, lack of hair growth, bone demineralization. Those are the signs, symptoms you could recognize. Then report at least one symptom. We did that. Demonstrate at least one sign in 2 of the categories at the time of evaluation. So the same list that we went over, 2 signs, at least one sign, one symptom, no other diagnosis that better explains the signs and symptoms. No other diagnosis that better explains signs and symptoms. So there should be, differential diagnosis is where there is no one other condition would match this description. Okay, sensory is where you're talking about allodynia or hyperesthesia, that is exaggerated pain or a central sensitization of pain. These are all abnormal pain sensations. Vasomotor is where temperature variability, skin color change, skin color asymmetry, pseudomotor edema, and are sweating changes and sweating asymmetry. Motor function is where decreased range of motion, motor dysfunction, weakness, tremor, dystonia, and are trophic, changes of hair, nails, or skin. So these are the ones that would help one diagnose that it is complex regional pain syndrome. Okay, all right. So that is where we finish off this one and this chapter. Thank you very much.